excites you the most currently in your hospital and going ahead?
I'm obviously technology driven. So now in an admin position, I am looking to push technology. I briefly spoke about VO2, things like that, bringing in other things. But one technology early that we brought in, which actually fascinated me, was that there were two IIT boys who came to me and told me that without touching the patient, we can tell you heart rate, respiratory rate, blood pressure. I said, how? I mean, this is like the movies where we used to see where they used to touch the pulse and say that the lady is pregnant. So, it was like that. I said, how is that possible? It's not possible. So I said, all right, demonstrate to me. And it's quite amazing. Today, every bed in Bridge Candy is what we call a Dozee bed, because Dozee is the system. It's a very simple system. Every bed in Bridge Candy is a Dozee bed today. Right. I'll tell you. What is Dozee? Of course, we started with 10 beds, 20 beds, and then when we thought, we expanded it. What does Dozee do? Dozee is a sensor which detects pressure very sensitively. Of course, you have AI involved in it, helping to magnify the signals. Yes. This is kept below the patient's bed. The patient is not in contact, not aware. There's a device to which it's sending the signals. And you have a monitor at the nursing station. You can have a monitor in the room also, and which gives the respiratory rate, heart rate, and blood pressure. Right. Now, why is it so important? Because when a patient is in the ICU, they're monitored. What about in the room? There's no monitoring. Of course, you don't put people in the room if they need monitoring. But what if something happens? And if something happens, we call a code blue, where you come in with an ICU team, come in and resuscitate. If we can reduce code blues, it's very important, because not everyone who has a code blue resuscitation is left without any neurological deficit or something like that. These things happen. So here we have monitoring the patients. We have a command center in Bangalore, because we know that there's nurse fatigue. There'll be alarms ringing, put the alarms off. So we have a command center in Bangalore, which has predetermined levels, heart rate, respiratory rate, blood pressure. And if there hits one of those critical, the call comes to the ward. If it's not answered, it goes to the ICU. And if it is of a very low critical alert, directly goes to the ICU, so that people come in and check. One benefit that I found as an administrator at a busy hospital like Bridge Candy Hospital, I knew if a bed was empty and I could get another patient in, because if there was no Dozee data coming. Right. Another area which we formulated with Dozee was, what happens? Patients are in hospital, they may be sedated, they may be on medication, and they get up at night to go to the loo and fall and fracture. And as you know, in an elderly, a fracture is usually the start of the downward spiral. Yeah. So we do a fall risk analysis. This one has more chance. We're on sedation. We have to watch this, that, all that permutations, combinations go on. But here we said, in addition, if this patient is a high fall risk, put a Dozee alert for fall risk. If they leave the bed, immediately the nurse knows that this person has left the bed. And we have caught a couple of patients in the middle of the night before they fell, that the nurse has got the alert. This person is no more in contact with Dozee.
With the bed.
At the bed. So, a lot of fabulous technologies coming in. And do
many hospitals have this Dozee?
So yes, now we are seeing hospitals adopting it. Apollo, Reliance, other hospitals. It's now going to the Middle East. It's going to America. It's an Indian product made in Bangalore.
That's very interesting.
India for the world.
Amazing. And you were the first hospital
we were the first
in India to do this.